The gentlewoman from Minnesota, Ms. Omar, is recognized for 5 minutes. We can't hear you.
My apologies. Thank you, Madam Chairwoman, for having me on your committee today, and thank you to all of our witnesses for your excellent testimonies. When a person needs health care, they should not have to worry about whether their coverage status will be a barrier. But unfortunately, that is not the case for millions of marginalized gender identities in the United States. Across the United States, transgender people are uninsured at a greater rate than their cisgendered counterparts. When trans folks who are covered seek care, they experience denials of medically necessary services at higher rates. Dr. Blackstock, can you speak to how these trends perpetuate stigma against trans folks and the broader LGBTQ plus communities in healthcare settings?
Yes, Representative Omar. So, one thing that we know that's that our healthcare system is not sensitive enough to the needs of the LGBTQA plus community, and that many of our healthcare providers are not trained in a way that is needed to provide the best care. But access is so incredibly important, especially for these communities, because we know that these health inequities exist and they're perpetuated because people from these communities are unable to access care. So I think Medicare for All will provide an opportunities for members from stigmatized communities to engage and access with the healthcare system. And the healthcare system also needs to be equipped to provide the resources and services in a culturally sensitive way and a culturally responsive way to these communities.
Yeah. Dr. Michener, what steps can Congress take to ensure that people of marginalized gender identities are able to access medical that are necessary care and free of stigma and financial barriers?
I think the sorts of policies, the commitment to universal coverage that we've been talking about here today is a first and critically important step. I think that there are barriers that are really concrete around simply being able to have access, and that's a sort of first point to address. Over and above this, though, I do think that we need to think about interventions that are sort of tailored to these uniquely marginalized populations, and so we need to be aware of what the unique challenges are in those populations, and I think part of what that means is understanding, talking to those folks, understanding better their perspectives and barriers, and connecting that information with the policy choices that we make going forward. So I guess the broad point I'm making is to really think about how we can improve voice in addition to access, so that the people who are most affected, who have really unique stakes around these particular kinds of barriers, can really help us to understand how to engage and move forward in a way that's going to address their particular vulnerabilities.
And I wanted to also ask you, as someone who supports Medicare for All and serves as the vice chair of the Medicare for All caucus, oftentimes we hear how universal access to care can lessen the quality of care that is available to people. Can you respond to that sort of critique as an advocate for universal access?
I appreciate the opportunity to address that. So one of the things that I always emphasize is that quality of care, just like access to care, is a choice. It's a political choice. And so many of the critiques that we've heard around quality to care, look at the VA and its weaknesses, or look at Medicare and its weaknesses, those are a reflection of political choices, choosing to underfund those services, choosing to create administrative burden and barriers, choosing to make life for people on those programs more difficult. And if we make different choices, we can have government programs that are just as well run, just as efficiently run, actually more so. than private options. And the reason is because there's no profit motive. We're not trying to maximize what we can gain in exchange for what we give in the context of a government program. We're trying to maximize what we can give in exchange for improving people's lives, saving their lives, and helping them to thrive. That's the best context for both efficient and effective programs that are going to help people. And to the extent that that's not what we have, it's because we're choosing not to put the pieces and the resources in place to achieve it.
Thank you so much for that response. I will just say, as someone who has been fully insured for the first time in my life here in the United States, I know just how much my healthcare has improved, not just having the anxiety of worrying about whether I could access, what Congressman Bowman was talking about, being able to pick up the phone, walk 10 steps to a medical professional to care for you. That's the kind of access that we want for everyone, and that's the kind of access everyone deserves. So again, thank you all for the opportunity to have this conversation. Chairwoman, I yield back.